Thank you all for participating in today's media briefing. This is our 28th since the start of the pandemic. These press conferences are a reflection of UPMC's ongoing commitment to provide timely and accurate information for all. I'm joined today by Dr. David Nace, Chief Medical Officer of UPMC Senior Communities and Associate Professor of Pitt's Division of Geriatric Medicine, Dr. Gadi Haidar, UPMC Transplant Infectious Diseases Physician and Assistant Professor at the University of Pittsburgh School of Medicine, and Tammy Minier, UPMC's Chief Quality Officer. They will share new data on how certain UPMC patients with weak immune systems responded to COVID-19 vaccinations and their clinical recommendations in light of these findings. They will also provide an update on UPMC's COVID-19 vaccination and monoclonal antibody treatments in the communities we serve. After their remarks, we will take your questions. Dr. Nace.
Thank you. From the very beginning of this pandemic, UPMC identified and shared information about a patient population that is very important to us, the immunocompromised or those with weak immune systems. This is a massive group of individuals encompassing everyone from HIV and end organ transplants to the vulnerable older adults that are residing in our long-term care facilities. These people are not all the same, and we shouldn't expect that they would react to the COVID-19 vaccination in the same way. While vaccine trials provide us with much needed information about safety and protection in the general population, we need to know more about vaccine response in vulnerable persons to help guide our clinical approach. Throughout all of this pandemic, UPMC committed to learning while doing. This means that from the very start of the reopening of our vaccination clinics throughout the regions we serve, as well as starting the vaccination programs in our long-term care facilities, we've been collecting data. And today we share early findings of two important groups: patients with certain types of cancer, which Dr. Haidar will tell you about shortly, and residents of our UPMC Senior Communities facilities. Nationwide, there have been more than 1.3 million cases of COVID-19 in nursing homes, resulting in about 175,000 deaths. This 1% of the U.S. population that resides in long-term care represents 33% of all U.S. deaths from this disease. Our studies were straightforward. We collected blood samples from people with these conditions or living in long-term care facilities a few weeks after they were vaccinated, when we would expect they would have peak response or immunity. And in a research context, we tested antibodies against a virus that causes COVID-19. In the 70 healthy Senior Communities residents who volunteered to participate in this study, we found that all of those individuals mounted a detectable antibody response after COVID-19 vaccination. The levels varied significantly among individuals, but all of them had antibodies. And I do want to reinforce that point. I also need to caution, though, because we know that while there is an antibody response to the vaccine, we don't know how good of an antibody response it is, how well does it protect vulnerable older adults, or exactly how long does this antibody response last. These are key questions that we're seeking answers to in our ongoing research efforts. We know that older adults typically have a less robust and less durable immune response to other vaccines, such as the seasonal flu vaccine. As an example, shortly after a flu shot, older adults mount an antibody response, but those antibodies decline over the course of the next several months. And until we can answer these questions, it's important for us to continue monitoring for COVID-19 symptoms, particularly among those who live in long-term care facilities, whether they're vaccinated or not. But the good news is that you might recall from our briefing just a couple of weeks ago that we have an effective treatment for those who do get COVID-19. Monoclonal antibodies, if given early, can prevent hospitalization and death. These are one-time infusions that we provide at multiple centers throughout the regions that we serve, as well as in our long-term care facilities. And now Dr. Haidar will tell you about his team's findings in patients with a certain type of cancer.
Thank you, Dr. Nace. So my colleagues at the UPMC Hillman Cancer Center and I did a similar study in patients with cancers that affect the blood, bone marrow, and lymph nodes. And these patients are at very high risk for death if they develop COVID-19. And while these patients are prioritized for COVID-19 vaccines, the trial supporting these vaccines actually didn't include these patients. And so this means that without more work, we really wouldn't know how well COVID-19 vaccines work in these kinds of patients. So just like Dr. Nace's project, we collected blood from 67 volunteer patients who have blood cancers a few weeks after they'd been fully vaccinated against COVID-19. And we found that more than half, so 54%, actually produced detectable antibodies to the COVID-19 virus. But that leaves the 46% who did not. And there's also a subset of these patients, specifically patients with a kind of a blood cancer called CLL, or chronic lymphocytic leukemia, in whom actually 77% did not produce any antibodies. Now, what does all this mean? So like Dr. Nace said, this finding does not mean that the vaccine did not work in these subgroups of patients, because honestly, there's a lot more to our immune systems than just antibodies. It is a very complex system with hundreds, if not thousands, of elements all working together to help us fight off infections. Now, and also, our findings in these patients aren't necessarily surprising because we know that their immune systems are weak. But this does mean that we need to continue to be vigilant and we need to continue to be cautious, meaning that everyone should continue to wear masks and to social distance even after they get the vaccines, especially people who have blood cancers. Those around patients like this should do the same. And then if these patients get COVID-19 symptoms, they should go get tested to see if they actually have COVID-19. And finally, if they do have COVID-19, we can give you monoclonal antibodies. So you need to seek that treatment out. And really, honestly, right now, if you're over 12 years old and have one of these conditions, you would qualify as long as you seek this treatment early. But, this isn't the end of the story. We're continuing to expand this work. So we really want to know why these patients didn't produce antibodies. This is really going to help us get some more insight about COVID-19 and how best to manage patients like this. And we're also interested in other groups of immunocompromised patients. So for example, people with other cancers, persons with HIV, persons who have had organ transplants, and persons with autoimmune conditions. But I really want to emphasize one point, which is even though nearly half of these patients didn't produce antibodies, the other half actually did, which really tells us that we do have a relatively effective vaccine to COVID-19, even among patients with certain kinds of blood cancers. And, many vaccines we use for other infections like influenza do pretty much the same. So to wrap up, if you're eligible for a COVID-19 vaccine, especially if you have a weak or suppressed immune system, please get vaccinated. And if you do develop COVID-19 after that, please seek us out to get monoclonal antibodies.
Thank you, Dr. Haidar. And I also want to emphasize, if you are immunocompromised, please get your vaccine. We are ready and willing to vaccinate you. Let me review some amazing key numbers about UPMC's vaccination efforts over the last several months. To date, we have given more than 364,000 doses of COVID-19 vaccine across Western Pennsylvania, our Altoona region, Susquehanna, and Harrisburg regions. Really an amazing number. Nearly 233,000 of those individuals are not affiliated with UPMC. We truly want to thank the Pennsylvania Department of Health leadership for assuring the supply is becoming more available and predictable, allowing UPMC to administer 40,000 doses alone last week. This is really fabulous news. We have vaccine and we want to vaccinate you, and we urge you to get the vaccine. In partnership with the Allegheny County Health Department and the Pittsburgh Penguins, UPMC will host Allegheny County's first and largest drive-through clinic for the J&J vaccine on April 14th and 15th at Pittsburgh Mills Mall. The J&J vaccine has been much in demand, and it requires only one dose to reach full effectiveness. Over the course of those 2 days, UPMC will vaccinate 12,000 community members. This is about 700 people an hour. We will have 35 stations set up that are like a pit crew. When you drive up, you register, you get your shot, wait a little bit, 15 minutes, and then you head home. What easier process could there be than that? It's that simple. Cars will just keep moving through about every 2 or 3 minutes. The news is even better than that. We will hold another very large vaccination event for 12,000 people at the Mills towards the end of the month, too. So stay tuned for those dates. More importantly, by those dates, everyone in the state of Pennsylvania will be eligible to receive a vaccine. Mass vaccination clinics are a very important and effective strategy for getting shots in arms. However, let us be really clear about UPMC's commitment to community-based vaccination clinics, reaching all, not just those in one area or those that have a car. We continue to accelerate our community partnerships to take care of our most vulnerable community members. We are strategically creating clinics to ensure access for all. We are stepping in to help non-English speaking individuals get their vaccine, along with partnering with faith-based clinics across our communities we serve, so that we can begin to also focus on vaccinating the homebound individuals. All of these groups are extremely vulnerable and continue to be UPMC's priority. Vaccination is just one important layer of protection in our efforts to end this pandemic. We need to continue with the other critical measures of masking and distancing, as Dr. Nace and Dr. Haidar have emphasized. We also want to remind you again about monoclonal antibodies. These are a key treatment option for people that get COVID-19. 2 weeks ago, we told you about this treatment in reducing the risk of hospitalization and death. It's given through a one-time infusion to certain people soon after their diagnosis of COVID-19, while their symptoms are not severe enough to require being in a hospital. Since sharing that news, I'm delighted to share that the demand for monoclonal antibodies at our infusion sites and emergency departments more than quadrupled. We have treated more patients in the last 3 weeks than at any point in time prior in the 3 months since receiving approval from the FDA for this medication. We have 45 sites across UPMC, including our emergency departments, that are able to do that. To our media colleagues, thank you for getting that word out. Your work in sharing this important message is helping save lives. It's super critical. And I end again with, please continue to get your vaccine and allow us the opportunity to keep learning how we keep ourselves safe as we work to end this pandemic.
Thank you, Tammy. Thank you, Dr. Haidar. Thank you, Dr. Nace. And now we'll take questions from the media. To ask a question, you'll have to go to the participants icon at the bottom of the page and press the raise your hand button. That'll put you in our queue. I will read your name and your line will be unmuted for you to ask your question. We'll try to call on as many different media outlets as we can in the time we have allotted. And again, go to the bottom of your page, to the participants icon and press the raise your hand button. I'll throw you in our queue. When I call on you, please remember to unmute the microphone on your end. First question comes from Paul Goff at the Pittsburgh Business Times. Paul, please go ahead.
Hi, thank you. I think this question would be for Tammy. It seems like we might be reaching a point where demand, at least in some cases for the mass vaccination clinics, have started to outstrip supply. Or not the other way around, I'm sorry. Are you confident that you'll be able to find, to be able to fill all those appointments for shots?
We are making excellent progress in filling those slots already, Paul, and are continuing to push through every avenue and opening up to all aspects of UPMC's patients, members, and community to be able to sign up to get their vaccine through these drive-thrus.
Thank you, Tammy. Next question, Sarah Bowden, WESA FM. Sarah, please go ahead.
Hi, good morning. Thanks for taking my question. This is for Tammy. I would love to learn a little bit more about what your plans are for servicing harder to reach communities. You mentioned ESL communities, homebound. I know you said you were working with religious organizations. We'd love to hear some more details on that.
Well, thank you. It's a great question, and one that's been really a passionate field of work for UPMC from the beginning of this pandemic. We have been partnering with many of our diverse community leaders. We've recognized the importance of going to those communities to engage on one-on-one conversations to build the trust and the confidence in the processes that we have put forward. We also have a comprehensive sign-up list where we've allowed community leaders to reach out to us to say, we need help, and will you help us? We've gotten so many champions that have gone into various settings that have been highlighted in the media recently, and we have over 15 additional pop-up locations already planned in the coming weeks. So it's about partnership, it's about engagement, and it's about building trust. And we are committed to continuing to do that until every last request is filled.
Thank you. Dr. Haidar, what should cancer patients do? Should they get tested to see if they have the antibodies? Should they get another vaccination?
You know, these are really, really good questions. At this point, the guidance is that all post-vaccine antibody testing should be done under research. And I agree with this because on a practical basis, honestly, whether or not a vaccinated immunocompromised person develops antibodies should not really impact how they go about their lives. So we should continue encouraging masking and social distancing. And also, like we said, if they develop COVID-19, we have monoclonal antibodies to give. As far as your second question, that's also a really good question. Right now, we are recommending not giving additional doses of vaccines, and this is also consistent with guidance and guidelines. We don't even know if such patients would even respond to a third dose of a vaccine if they were to get one. Obviously, if new data emerge that suggests that they do, we are ready to proceed.
Okay, thank you. Next question from Bill Kibler, the Altoona Mirror. Bill, please go ahead.
Thank you for taking this. Has the sort of thing you reported today about the failure of some cancer patients to generate antibodies been found anywhere else in the country?
Yes, so there are a few reports here and there coming out, not just from this country, but from others about immunocompromised patients, be they cancer or transplant patients, who seem to have weak antibody responses to COVID-19 vaccines.
Okay, thank you. Next question, Aaron Martin, WPXI TV. Aaron, please go ahead.
Thank you for taking my question. This is actually for Dr. Haidar as well. When you went into this process of studying patients with blood cancer and things of that nature, were you expecting that there wouldn't be the same response from the vaccines, or was that something that was a little unexpected?
I was absolutely expecting this because if you go by the influenza literature, for example, there's a lot of data out there in people with cancer and transplants that show that such patients don't respond to those vaccines as well as people with normal immune systems. So I didn't find our findings surprising.
Thank you. Next question, Stacy Burling, Philadelphia Inquirer. Stacy, please go ahead.
Hi, this is a question for Dr. Nace. Given that you don't really necessarily know what an antibody test tells you about actual protection, and that lots of healthcare workers have still not been vaccinated, what are you seeing in the real world in your senior facilities? Has the vaccine been protecting the seniors who have been vaccinated?
Thanks, and that's a good question. I think the important thing to remember is that we're early on after vaccination. So the tests that we've done here were done within 50 days of vaccination. So this is really at the best point of antibody response. Having said that, we have had cases of individuals, residents within our long-term care facilities, who have gone on to get COVID-19. Primarily, most of them were after that first dose, and usually shortly after the first dose, just indicating they hadn't had chance yet to develop that antibody response. But we have had some individuals after the second dose of the vaccine that have gone on to develop COVID-19. What I think is important in this distinction is that the importance of getting that vaccine is critical because these individuals after the second shot have been asymptomatic. So that means the vaccine is providing some degree of protection there. We would have expected at least some of these individuals to have become symptomatic. And so that is really telling us the importance about vaccination. It's also important because I think it tells us the importance of staff vaccination and what we need to do because we know nationally the vaccination rates, particularly in long-term care among staff members, are far less than desirable and far less than what we would expect to provide that full level of protection. So really it helps us to really kind of push to say, continue the vaccinations, continue to make sure we take the necessary precautions, and continue to work on those staff vaccination levels across the country for our long-term care residents.
So Dr. Nace, given your findings, does this mean nursing homes should remove restrictions and reopen?
This is a great question. This is a $64 million question that everybody wants to know. Can we reopen the nursing homes? How fast can we do it? And that's part of the reason why we did this study. We did this study to really kind of help guide us because there is guidance or directives from Medicare about opening nursing homes. There are some publications out there, some thoughts that people have published in terms of how to go about the reopening, but no one's ever looked to say, how do we assess the risk in this population of patients? And this is really one of the first studies to really look at that and to really try to define what is the risk in this vulnerable population. If we had looked and seen over half of these residents did not have antibodies, it would have said we really need to be much more conservative in our approach. Whereas the fact that we're finding antibodies in all these individuals, although they did vary quite a bit from very high to very low levels, it does mean that we should proceed with reopening. It should not restrict us. We do need to be thoughtful. We do need to be cautious. We still need to use the mask, hand hygiene. We need the physical separation. But we really should be taking efforts to start decreasing the negative impacts of social isolation on individuals and start to reopening some of these facilities. Again, cautious, measured approach to doing it. And what's incumbent upon this is when we do this, I think this is really critical. You still need to continue to look for symptoms. You still need to test for asymptomatic cases. And if you find them, you need to refer patients for monoclonal antibody therapy because that is something that is very effective in reducing both hospitalizations and deaths.
Thank you. Next question, Sarah Bowden, WESA. Sarah, please go ahead.
So correct me if I'm wrong, but I believe the study on the cancer patients is a preprint, and I think that's the same for your study, Dr. Nace. So I guess my question is, why do you feel comfortable sharing this data at this point before it's peer reviewed?
That's a good question because I think that we need to alert the world that patients with cancers may not respond to the vaccines as well as others. And I don't want patients like this throwing caution to the wind and not masking and not social distancing. We need to emphasize to patients like this that you may not be fully protected. So please, please, please continue taking the usual precautions of masking and social distancing and hand hygiene.
And I would add, Gadi, I know it's implied, and get your vaccine. The real additional point of that too is just because we've seen some of these early findings in no way should deter from anyone's commitment to going forward and getting the vaccine. They are safe, they are effective, and they work. And we're continuing to learn what all of this information means. And UPMC has always been committed to the spirit of transparency in our learning.
Completely agree.
And to add to that, I think what's really important is why we're sharing this information now and where is our comfort level. What we have realized is that from a year ago, 1 year ago, we did not know about masking, whether it was effective or not. 1 year ago, we did not know whether or not individuals who are asymptomatic were capable of spreading. We have learned tremendous amounts in this past year. But if you look at the published literature, It takes a tremendous amount of time to get that into press. And there's stuff that has come out that we've looked at and said, we knew that a month ago. We knew that 2 months ago. This is information that really is critical. We've been vaccinating residents since December. We need to know now whether those residents are responding. And we won't have all the answers. But the key is that we've looked at from an organizational perspective, UPMC is about learning. It's about taking a look at what we're doing and making sure that whatever we do, we put continuous quality improvement behind it, push it forward, and share that information with others so that others can innovate as well.
Thank you. And Sarah, this is part of UPMC's commitment, as you know, to share information on as timely of a basis as we can. And that's why we've been doing these press conferences over the past year. So when we know something, we want to share it with the media, and we want to share it with the communities and patients we serve as quickly and as accurately as we can. Next question, Aaron Martin, WPXI. Aaron, please go ahead.
Thank you for coming back around to me. This is kind of a general question. I'm not sure who'd be the right person to answer it, but given the study that Dr. Nace had mentioned regarding senior care facilities and the possibility of reopening, but then the challenges that exist with staff getting vaccinated, is there a scenario where UPMC would have some kind of requirement for staff in long-term care facilities to get vaccinated?
I actually think that's a great question. You know, from the beginning of this pandemic, UPMC has wanted to always be on the forefront of doing what's right to keep our employees and our patients safe. So with that in mind, we have not mandated the COVID vaccine for our employees yet. We are starting to see across the United States other organizations that have begun to do that. We took a very thoughtful approach about mandating our flu vaccine and worked with our employees to get to the point that now we have just an incredible compliance rate of nearly 100%. We will take those situations under advisement as we go forward and continue to learn, as David points out, about the effectiveness of that strategy in keeping our patients safe. But our first commitment always is to keeping our patients safe and our employees safe along with them.
Yeah, and it really is the fact that we're learning as we're going. And times will change. Where we were a year ago versus where we are now versus where we were in December with vaccinations coming out. But the key when we started vaccination is that the thought around mandating vaccines, it was important not to at that point in time because some people were scared of the vaccine at that point. And as we've gained experience, people are becoming comfortable with this. It's about providing education. It's about teaching people about what the benefits of the vaccination are and letting them get to experience it so that we can develop moving forward. And that builds trust. And that's key and essential to an organization's integrity. So,
Thank you. Next question, Maria Simbra, KDKA TV. Dr. Simbra, please go ahead.
Good morning.
Morning.
I just had a question about, well, maybe a comment for you guys to make. You're planning a large Johnson & Johnson vaccine clinic, drive-through clinic. So maybe you could comment on the recent pausing of the J&J in North Carolina after a couple dozen people out of a couple thousand had some symptoms of lightheadedness, fainting, rapid breathing, and it caused them to pause the clinic. Could you just comment on that, please?
Thank you, Dr. Simbra. That information is relatively new, and as you would guess, we will need an opportunity to review that. From everything we know, the J&J vaccine has been administered very effectively and safely across the world, and so we are very committed to its safety at this point in time, but we'll continuously learn from experiences like that if there is anything more to add to our knowledge.
Tammy, as a follow-up, are we seeing more of the B117 or the UK variant?
Great question, Paul. And yes, we are. Our labs have identified this variant in patient samples, and we know from our partners at the county and the state that it is present in Pittsburgh and in other regions. This really, though, has not changed our clinical practice or our approach to public health advice. Continue to wear a mask, continue to get your vaccine, continue to not gather in crowds. We do know also that these vaccines are very effective for, in particularly, the UK variant. And if by chance, again, a reinforcement, you would still get COVID as a result of being exposed, please know that the monoclonal antibodies also are there for you to support your treatment and recovery after such an illness. But yes, we're seeing it, but we feel very confident that what we're doing are the right treatments.
Thank you, Tammy. And we'll go to Sarah Bowden again. Sarah, please go ahead.
Hi, thanks for taking another question. This is for Dr. Nace. So you mentioned that it's time to start, giving people in long-term care facilities more freedoms to mitigate the isolation. And I'm just wondering, what are some of the things that residents are now able to enjoy now that we're at this point in the vaccine rollout?
Sure, it's a great question, and I think this has been a tremendous challenge. In part because what we're seeing is that we have guidance around our nursing homes to reopen. There hasn't been much guidance around assisted living. It was just this past week that the state offered guidance that's very similar to the nursing home guidance. And then in independent living facilities, we have no guidance at all. And so each facility has been kind of left on their own to try to figure out what to do. Indoor visitation, allowing outdoor visitation now that the weather is getting better. And actually that the weather is atypical for Pittsburgh, which is good. Those type of things, should be things that all facilities are starting to offer now. The question is to what extent, how many visitors can come in with a person at a time, where those persons can go in the facility, whether it's in a set-aside visitation area versus in a patient's room. Precautions if somebody's in a semi-private room where there's one or two residents in a particular room, that might be a more risky type of visit, and you'd want to have that person on a one-to-one visitation. So those are some of the things that we can start to really take a look at. The distancing in the dining room, as an example, too. Do we allow one person at a table, or do we allow little pods of individuals who stay together most of the time that some school districts have taken the approach of? So these are all things I think are challenges that each facility needs to look at within their own building, seeing what is available to them and what is capable in their own facilities. The other challenge, frankly, that we're having is that we know under the nursing home guidance that when there's a new case, whether it's a staff member or a resident, the entire building must shut the visitation down. And this is a tremendous challenge because until we get enough individuals vaccinated, we're going to continue to see these cycles. And we've seen buildings all across Western Pennsylvania that have open visitation at 8 o'clock in the morning only to shut it down at 10 o'clock in the morning, because that's the challenge. So it goes back to encouraging vaccination and making sure everybody is doing their part to protect each other.
Okay. Maria Simbra has a follow-up. Maria, please go ahead.
Hi. Thank you. Thanks for coming back around. So my question is about young people and the vaccine. I've seen some reports that there's some hesitancy amongst people 18 to 24. And it might be because there's not as much messaging to this particular group, and they see themselves as healthy and that they would do well with the virus, and they sort of wonder, well, why should I get the vaccine? Could you address that and how you could target this group?
Thank you, Maria. It's another really good question. The reality is many of the 18 to 34-year-old individuals are healthy, right? Thank God. And they have not been eligible for the vaccine. So I think we've had some difficulty discerning, has it been hesitancy or has it been the fact that they're eligible? So now that we are opening up to all eligible individuals, I think we will see over the next several weeks, hopefully, a pivot of that response, and we'll start to see many of those younger folks sign up. If not, then you're absolutely right. We, along with all of our colleagues at the state, will need to do some targeted messaging about the importance of doing this. Even though you are young and healthy, it's to protect the people around you also.
Yeah, our core message about vaccination has always been the sense it's not about me, it's about us. And that's the messaging that we have to continue across all populations.
Okay, thank you, Dr. Nace, Dr. Haidar, Tammy, thank you very much. Thank you all for attending to our friends in the media. In about 45 minutes, we will email to the media attendees a link to download high-definition footage of this entire press briefing, which we do encourage you to use in your news reports. If you have any follow-up questions, please contact UPMC Media Relations at upmc.com/media, and please follow @UPMC News on Twitter for updates. Thank you very much.